everyone. As mentioned, I'm a general pediatrician at Full Bloom Pediatrics, and they asked me to present today on developmental disabilities. And that's something that as a general pediatrician, we spend a lot of time working with children who have normal development and also what we consider atypical development. So I'm not sure if you're familiar with the fact that in 1987, Ronald Reagan made March Developmental Disabilities Awareness Month. So that's one of the things that we celebrate in March. And he designated this month as a way to really just create public awareness of the needs of those with disabilities, and really wanted to help encourage people to lead productive lives. And so the American Disabilities Act was started, and it's divided into 5 areas, which include employment, public service, public accommodations, telecommunications, and then there's a miscellaneous section. And that act there was an amendment to the act in 2008, which broadened the definition of disability. So you probably notice really in your daily life, there are places where you can push a button and the doors are going to open. You know that from a law standpoint, there are laws available for those who have disabilities at the work environment and in the school setting. So it's really allowed those with disabilities to participate in a greater way in the American life. So in preparing for this lecture, I was reminded of a lecture that I saw by Andrew Solomon. And I'm not sure if you're familiar with him, but he's a professor of psychology at Columbia University. And so he did a TED Talk, which he described a memory of childhood. And he discussed that power of nature versus nurture. And he'd written a book called Far from the Tree. And in that book, he writes about families and the uniqueness of families in that they will have children that are deaf, and children that are dwarfs, or have Down syndrome, or autism, or schizophrenia. Really, the list goes on. This book was about 40 hours long, but I did listen to it. And it was really pretty fascinating because what he did is described differences within families that ultimately end up uniting us. And he said, what parenting tends to do is turn to this crucial question of to what extent do we accept our children for who they are? And to what extent do we help them to become their best selves? He interviewed about 300 families and showed the challenges that those families faced, whether it was considering prenatal screening or whether it was determining if they needed a cochlear implant for their deaf child. And he just really narrates kind of compassion between these families and finds that a lot of times families grow closer because of the differences that are there in their children. So I listened to this book on tape as I was actually driving my son back and forth to Deming, where he was working with someone for meditation and hypnosis. And it was my natural inclination as a parent to want to help him. He was kind of a little bit ADD, a little bit spectrum-y, and I, kind of just ran around all the time. I felt he just needs to feel calm. And I think in the end, when I finished listening to the book, it really made me recognize that I need to figure out what he wants to do and how I can support him, and not necessarily tell him how I think he needs to be. And he definitely had challenges growing up. I think he was kind of that round or square peg, whatever you want to say, square or round. But, there are definitely times where that square peg, the teacher wanted to put him in a round hole and he was not going to fit. And so as he got older, what I found is we talked about those differences a lot more, and he found ways to sort of navigate some of those challenges personally. And I think that's what parents of children with disabilities do. They find where their children have strengths and where their children need support, and they help them to navigate that. So the objectives for today, I want to go through a list of what's considered a disability. And then I'd like to go through just typical developmental milestones, because I think in order to know what's considered a disability, we want to understand what's considered normal. There are lots of supports for children, so I want to explain how you can find those supports, how children can be evaluated. And then we'll look at learning disabilities, and then what supports are available for children that have learning disabilities. All right, so what's considered disability? And I'm going to go through just a long list. And really, this list is not all inclusive, but it just gives you an idea. Attention deficit disorder is considered a disability, autism spectrum disorder, blindness and visual impairments, cerebral palsy, deafness and hearing loss, developmental disabilities, which we consider gross motor, fine motor, and then language problems, Down syndrome and other genetic disorders, emotional disturbance, epilepsy, intellectual disability, learning disability, and of course, learning disabilities can be divided into several different types, speech and language impairments, traumatic brain injury, and visual impairment. So, the list really is not complete. It definitely be extended, but it gives you an idea of how broad disabilities are. So once we are able to identify those as a physician, we're really able to give people more support. So let's just talk about normal development. One of my favorite parts of my job is doing well checks. And we start those at birth, and then 1 month, 2 months, 4 months, 6 months. It kind of ties in my job with vaccinations. So a lot of those visits include vaccinations, but of course, as you get older, it's mainly just your yearly well check. So we look at their gross motor skills, which is their ability to move throughout their environment. And when you think about it, it's fascinating in the sense that a baby has very little head control when they're first born, but by the time they're a year of age, they'll begin to walk. We look at fine motor skills. And so this is often what you think of, the use of their hands. If you brush your finger on a baby's palm when they're first born, they're going to grab onto your finger. So that's just a natural reflex that we see. And of course, fine motor skills improve by 9 months. They use their finger and their thumb to pick things up. From a social skills standpoint, the way babies communicate initially is crying. And you'll also see babies who, like through a social cue, the way their body is picked up, they recognize they're getting ready to be fed, and that crying can settle down. So that's always nice that the child is recognizing that. From the very beginning, we make sure children can hear. They're responding to loud sounds like the bark of the dog in the house or the slamming of a door. Vision, we notice that they can see colors. Well, they tend to see more black and white in the beginning. And by the time they're a year, their vision is sharper and they can see colors. Speech is initially through a smile. I think everyone looks forward to that first smile when they're 2 months of age. And then from there, it progresses to laughter and babbling. And then self-care. So as children get a little bit older, once they have some of those skills, they'll start to do things to take care of themselves, like learning to put on their shoes, learning to dress, learning to brush their teeth and clean themselves. So with each checkup, we'll ask families to fill out a form before they come into the office. It gives them time in the home environment to look at their child and see where they fall developmentally. And what I found is that if I'm looking for those skills sometimes in the office, the child may not cooperate as well, especially if they're young. So it's really helpful to have the family fill it out beforehand. If you've ever seen a Denver developmental screening, it's a chart, but on the bottom line, it has ages. So it starts with 0 to 4 years of age. And then along the side, it shows gross motor, fine motor, speech and language and social skills. And there's little boxes that show this age range. So, when you're supposed to start smiling, when you're supposed to start talking, when you're supposed to start walking. And it comes up along that chart so that I might see it around 10 months of age, but it could be as late as 14 months of age. So parents have a range for when they expect to see that. So, okay. I'm just going to go through, starting with 2 months of age, what a typical summary would be. And after that, we'll go through things a little bit quicker, but just to give you a feel, think about a 2-month-old. They've come in the office. That's around the time they're first going to smile. So if a parent is at home the night before, they'll look at a survey called Ages and Stages, and that's the one that our office uses. So the first questions involve language and social cues. So the questions would be, does your baby make throaty or gurgly sounds? Do they make sounds like ooh, ga, or ah? Do they make sounds back to you? Do they chuckle softly? Do they smile when you talk to them? And if you've been out of sight and then you come back into sight, does your baby seem excited? So those are the cues that we're looking for at 2 months of age. Some babies may have these, some may have just one or two, some may have all of them. Then we'll look at gross motor skills. So while your baby is on the back, will they wave their arms and legs, wiggle and squirm? When your baby's on their tummy, do they lift their head up and turn from side to side? When he holds his head up longer will your baby hold their head up longer for just a few seconds? When they're on their back, will they kick their legs? Will they move their head from side to side? And then while holding their head up on the tummy, will they lay their head back down after a few seconds, or will they let it drop? That's, of course, looking at strength of the head. For looking at fine motor skills, we know that when babies are first born, their fist is held pretty tight. So over time, that fist is going to open up a little more. And I start to see that at 2 months of age. But what we still expect is if we run that finger into the palm, that they're going to grab onto it. So if you give your baby a toy, will they also grab onto that? We look for that. We look for the baby to touch their face with their hands. And of course, we're looking for equal movement. So do they use their right hand or their left hand pretty equally? And then we look for them to scratch their clothes. Visually, we look for a baby at 2 months of age to look at something when it's only 8 to 10 inches away. And then we expect them to also follow something if it's moving in front of them, follow it with their eyes. One app that I've actually shown parents starting at 2 months of age is called Baby-See, and it has a visual stimulator on it so that you can see how a baby sees when they're just 2 weeks, and you can see how they see. You just scroll across and go to 1 year. So you'll see that change from black and white fuzzy to colors and sharper and clearer. And I especially think that's nice when families have older siblings so that they can show the sibling kind of, this is what your little brother or sister can see. From a personal social skill standpoint, the parents would be asked questions about how the baby responds to a toy dangled in front of them, if they tend to cry when they're hungry or tired, if they tend to smile back at the parent, and if they look for reciprocal smiling. So I smile and the baby smiles back at me. They ask if your baby will get excited when they can tell they're getting ready to be fed. And then finally, the last few questions that ages and stages will ask is they'll confirm if the newborn hearing screen was completed and the baby did well. If the baby is moving their hands and legs well equally, which I kind of mentioned earlier. And if there's any childhood or family history of deafness or vision impairment, whether the baby had any medical problems, because of course it's good to review any medical problems from birth. And then if the parents have any other concerns. So this ages and stages really gathers a lot of information before the family comes into the office. It summarizes it for me, and then I can talk to the parents about whether that development looks normal to me or whether it doesn't, if it has a concern. So that's just 2 months. What I'd like to do is go through the next kind of sets of normal development a little bit quicker. So at 4 months of age, we'll find that infants will start to roll back and forth. That's the main gross motor skill that we're looking for. And when I first started, babies were actually still sleeping on their stomachs when I was starting to practice in the 90s. And that was when the SIDS campaign came out. We recognized that when babies were face down, in addition to some other factors, that it raised their chance of sudden infant death syndrome. So since we started the Back to Sleep campaign, we found that babies are rolling again, because I missed that part, that when we switched them to their back initially, babies weren't rolling as fast. So when we started them sleeping on their bellies, they would roll over at 4 months. Switching them to their back, they didn't. So the Back to Sleep campaign encouraged tummy time, and babies started rolling back at their normal milestones again. So we also look for babies to bring their hands to midline, and this has to do with brain development. because after 4 months of age, they'll start to reach across and they'll transfer things from hand to hand. And again, that's significant because we can tell their normal brain development is occurring. They'll mouth objects, start to put their hands in their mouth. And of course, if you have children, you'll recognize too that teething is a little bit of what we're starting to see. They also respond to new faces differently versus a face they recognize. And I still remember at one point during the pandemic, I had a baby in the office with his mother, and the dad was out in the car and was getting ready to come in. And of course, we were all still wearing masks. And the dad walked in the room and the child just stared at the father because he had a mask on and she wasn't used to seeing him with the mask. And then he took it off and she just started laughing. So it really sort of reinforced that point of, okay, she knew who he was now, and you know, it just made her happy. Moving on to 6 months of age. So after we roll, we look for sitting. The last thing 6-month-olds learn to do is to not fall forward. So often you can prop them up. I don't know if you've heard the little boppy, but it's a little pillow that's in a U shape. You can prop that around their bottom and that'll stabilize them. They may wobble a little, but the last thing they do is not fall forward. This is again where I mentioned they cross the midline. So they move things from the left hand to the right hand. They'll rake things in and grab things. And then they start babbling, making noises, just little sounds with their mouth. No particular reason to how they make those sounds. At 9 months of age, they start to creep and pull to stand for brief periods of time. This starts to really strengthen their hips, and really, I'll encourage parents to just put furniture close together so that they can go from the couch and reach over to the ottoman and then maybe reach over to the table so that they feel comfortable learning to walk. I will say you can even start to see a little bit of a baby's personality at this age because some babies are more daredevils than others. So if you have a child that is really, I guess, more almost like a perfectionist personality and thinks through things, you'll see them taking things slower because they're even already thinking in their mind, what if I don't make it over to the ottoman? And so they'll be slower to cruise over to different items or objects. There's a social phase that comes in at 9 months of age where they'll be waving, they'll respond to their name, they'll start to recognize words, and you may hear them saying mama, dada, just because, of course, you know, you've been probably saying it around them. They don't usually say it specifically, looking at you and saying, okay, you're mama or you're dada, but they will start to make those sounds. At 1 year of age, children are standing pretty well. They're taking some independent steps. They'll start to scribble and feed themselves. One of the skills that we look for is called joint attention. So that means a child is pointing and they recognize that what they're pointing at is way across the room. And this is an important skill when we think about autism, because children with autism don't understand that skill that's called joint attention. When they hold out their finger, they're looking at their finger. So they're not looking at what's in the distance. At 15 months of age is when I feel like their personalities really start to bloom. And this is where you'll start to see kids refusing to do things because they just don't want to. They'll start to climb on furniture and stoop things down and pick things up. They'll walk while carrying a toy. They may start to use a spoon. I think it's not uncommon to see them holding a spoon, but eating everything with their hand because that gets it in their mouth a little bit quicker. They'll turn pages in a book. They'll work with shapes, connecting those shapes in a puzzle. I remember at this age, my youngest was kind of an early walker. And so I had 2 older kids. So I had this little drawer in my fridge where the kids could open it up and grab a little cup of yogurt and a little cup of, like those yogurt smoothies. And I recognized at one point that all the banana smoothies were remaining and I could not figure it out. And so one day I actually saw my little 15-month-old go over, open the door, pick up the container, look at the picture on the front and throw it back in, and then pick up another container and look at it. And I was just fascinated a little bit with that because she was making that connection with the color on the label and then the taste of the drink. So at 15 months too, babies will start to jargon a little bit, probably have 4 to 5 words. Their receptive language is probably still the strongest piece that we notice at 14 months, though. At 15 months, sorry. At 18 months of age, they're starting to run and they're starting to throw a ball. They'll take their clothes off. I think it's always fun to see a child at 18 months. You'll say, what does a cow say? What does a cat say? They'll love making animal noises and they love to point to their body parts. So, where's your nose? Where's your head? Their vocabulary around 18 months of age is about 20 words. And just to give you a feel, you think about most kids are going to start combining words by 2 years of age. So they go from a vocabulary of about 20 words to a vocabulary of about 50 words. And that 50 is kind of that magic number when they'll start to combine words. So that kind of moves me to 2 years of age when they're combining the words and starting to use what you would say like two-word sentences. I would also say that a 2-year-old, I can understand about half of what they're saying. So that's just a generalization. Parents are always going to be able to understand a little bit more, but you kind of wonder what that outside person would understand. A child also at 2 years of age could understand a 2-step command. So, take this cup and take it to your dad. They would understand that. When other children are around, though, 2-year-olds will have what we call parallel play. So they're side by side and not necessarily playing with each other, but playing next to each other. And then finally, 3 years of age, they alternate their feet going up and down stairs. They pedal a tricycle, and that's cross-lateral movement is really important, again, with the brain development. They'll throw overhead, they'll catch a ball, they'll start to copy a circle. They'll be able to string beads. And 3 years of age is when they start to categorize things. So they'll know their name. They'll say, okay, I'm a boy, you're a girl. They like to put people into little groups. And I think that's just their way of starting to organize their world. And then they have a pretty good vocabulary. So they have about 3-word sentences plus at this point. And if I were the outside person, I would understand about 75% of what they're saying. So they're usually pretty clear with their speech. So, okay, and from there, really, we have yearly checkups at that point, but those are often key times of development. And if we find there are things that are not matching up before the age of 3, we have services that can help families. So that's what I want to talk about next. It's identifying developmental delays. So we have the surveys that I mentioned, and then we just have our visual eyes when they come in for a checkup. And so if at all there's a concern before 3 years of age, we will refer to what's called early intervention. And what's so great about the state of New Mexico is they provide early intervention services for everyone under the age of 3. If I'm in Las Cruces, and I know not all of y'all are here, so you may have different names for your groups, but we have Mecca, Trusco Tots, and Aprendamos. And those groups have physical therapists, occupational therapists, and speech therapists that will, when referred, will meet with the child and just do a baseline evaluation. And then if they find that those children have more than a 25% delay, then they will actually provide services to the family. And based on that delay, they may meet with them weekly, they may meet with them every other week, they may meet with them twice a week. So whatever is needed for that child. And they'll do that up to the age of 3. And I have found that it's really made a huge difference for parents. Often there are kids that we're sort of questioning and we think, oh, I don't know that there's a delay. They may just be a little bit slower, but they'll catch up. And just having that therapist to meet with the family and reassure them can be very valuable. So anytime I have a family that's questioning things, even if I maybe think, I think you're going to be fine, I find that using those services can be really helpful. So the next thing I want to talk about is autism, because that's something that comes up during this time frame. And one of the evaluations that we will perform on children at 18 months and 2 years of age is called your MCHAT. That evaluation is about, I want to say it's probably 20 or 30 questions, and it's been downsized now to something called the QChat. And the QChat is only 10 questions. These are the questions that the QChat has. Does your child look at you when you call his or her name? How easy is it for you to get eye contact with your child? Does your child point to indicate something she wants? This is, again, joint attention, which I mentioned a little bit earlier. Does your child point to share interests with you? Does your child pretend? Does your child follow where you're looking? Would you describe your child's first words as typical, atypical, slightly unusual, or my child doesn't speak? And does your child use simple gestures? Like, some of the gestures I think about will be sign language, but you think about some kids will even do this, like up, like, lift me up. Does your child stare at something with no apparent purpose? So we found that those 10 questions really helped to identify if a child may have autism. And after that, after you kind of have some ideas and want to get an evaluation, honestly, that can be one of the trickier things right now, because it can take a while to get in line for an evaluation for autism. So we have a group up at UNM under the Department of Developmental Disabilities, and I think their wait is around a year. We just started a group at NMSU, and I think that one probably you can get in with 3 to 4 months. And there are individual providers in the state, mainly psychologists that have done specialized training. I would say the best evaluation for a child does tend to be that team approach. And that will usually include a psychologist, either a general pediatrician or a developmental pediatrician, a speech therapist, maybe an occupational therapist. And if possible, that team would like to observe the child, maybe usually it's in the office, but if they can observe that child in their home or in the school setting so that they can really see how they respond to different settings, it really helps the evaluation. So what's important about autism too is that you can have an educational diagnosis and you can have a medical diagnosis. And that's important from the standpoint that when you are able to receive that educational diagnosis, parents are able to develop an IEP within the school, an individualized education plan for their child so that services are provided within the school setting. The other thing that the medical diagnosis really provides that I think so many parents find beneficial is applied behavior analysis, or ABA therapy. And that involves, again, some specially trained therapists that come into the home often and come into that setting, very similar to early intervention. They want the child to be comfortable, so they come into the home and do different activities with the child to help them engage better with their family and with the world around them. So if a child has been diagnosed with a developmental delay and they've received early intervention services, I think I mentioned earlier that they end at age 3. So what are the options after that? So what we typically will have is the child will enroll in something called the DD preschool, which is part of our public schools. And they need to have a 30% delay in that skill to be able to qualify for the DD preschool. So typically the parents will go to the public schools and fill out paperwork and be evaluated for that program. In addition to what's provided with the DD preschool, the New Mexico Public Education Department has resources online for families. And one is called the Early Childhood Network. They also have developmental delay resources on their site. And then they have the Division of Early Childhood and National Association for Education of Young Children. So there's lots of things that parents can find online to support their children in addition to these community groups. So you may also be familiar with something called the waiver, and that's something that any child with an intellectual or developmental disability can apply for from the state. And it allows supports, including a residential home, community, employment, therapeutic, family support, lots of things that families and the patients will benefit from. My understanding is it takes quite a while, and I have filled out paperwork for patients that are applying for that. And once they have it, I understand it's been very supportive to the families. Another waiver is called the medically fragile waiver, and that is for children who have what's considered medically fragile conditions in addition to a developmental disability, and it has to be before age 22. And this may include ongoing skilled nursing, maybe having some support, because a registered nurse actually is a case manager on these cases and may help with complex medical conditions, getting home health aides, physical therapy, speech therapy, occupational therapy, counseling. So it's really great because they are assigned this nurse to help them navigate some of their special needs. I have a patient on a medically fragile waiver who is actually finishing college, and he has a form of muscular dystrophy, and his parents had really supported even actually helping him to learn to drive, which when you think about having muscular dystrophy, that's really challenging. But he had a vehicle set up so that he can drive, and now he's going to college and really living as much like an adult as he can with those challenges that he has. And then the last waiver that we have through the state of New Mexico, and really these are federal too, is the Me Via waiver. And so in 1999, Medicaid and Medicare Services launched the community-based waiver program called Me Via, which means My Path. So this really gives families a little more self-directed care, kind of self-choice. And I find, you definitely have your families who know their patients really well, and or their children very well, and they really know what they need. And so they work with a consultant that helps them to navigate that and find those things that they need. So I'm not sure if you all are familiar with a book called David and Goliath. It was written by Malcolm Gladwell. And I tell a lot of families about this book. It's considered kind of a self-help book, but he talks about underdogs, misfits, and the art of battling giants. He talks about when we feel the strongest person will win, we often find that person that we thought it was impossible to win is the one that does win. And of course, you can tell it's the David and Goliath story that people are familiar with. He says, giants aren't what we think they are. The qualities that appear to give them strength are often their greatest source of weakness. And so what I find is when families come in and know their child has a challenge, they can feel really discouraged. But this book, I think, is an encouragement because it really talks about recognizing our own disabilities and how those disabilities can be strengths. And I'm not sure if you're aware, but a third of all CEOs are dyslexic. So what did they do in school? They were challenged because they had trouble reading and they had trouble on tests, and they probably weren't great students. But during that time, they might have even been troublemakers, and they learned good social skills and ultimately became leaders. So I really encourage parents to read that and to think about that when they're feeling frustrated with things. So I want to go through a few of the learning disabilities that we see. So dyscalculia is one where a person has trouble understanding math-based information or number-based information in math. Dysgraphia is actually a neurological disorder where you have writing disabilities. So the person's writing is distorted and incorrect. And of course, you're going to pick up on that about the time they start writing. Dyslexia is a learning disorder that affects their ability to read because they're not able to identify speech sounds and understand how those relate to the letters and numbers and words. Dyspraxia is a movement and coordination disorder. Nonverbal learning disabilities is when we have trouble with motor, visual, spatial, social skills. Sometimes I feel like it's a catch-all, but we find these children are often well-spoken and actually can write really well, but they won't pick up on social cues, and they'll often have trouble with abstract concepts. And then finally, oral written language disorders. These are children who struggle with understanding or expressing language, and this can be both in the oral and written forms. So when it comes to diagnosing learning disabilities, I think that's challenging. We do have diagnosticians in the public school system, and parents can ask for an evaluation, and it does take some time because I think that they're a little short on those diagnosticians. There are outside opportunities too, which I'll often encourage parents to look at that if financially that's an option. With some of these disorders, it's really challenging. I had a parent that honestly, her background was in the business world, and she was recognizing like the dysgraphia in her child, and ultimately it changed her whole profession because she became an occupational therapist. But I have another child now in my practice that we're concerned about dysgraphia, and we've had a hard time finding a place to have her evaluated. I do think that with the world opening up, like the fact that we can do these Zoom meetings and have appointments online, that will help a lot of our families. And of course, the internet's been a great resource for a lot of these families. So, okay. With that too, okay. I think I got that. One of the things I like to just talk about is how do we support these families? First of all, I think just being there in the room and listening to families can be so helpful. I still remember one time my mom who just cried about what was going on. And she said, you know what, I just feel better already because you were someone that listened. So I think we always want to be that person that can listen. And I think it's okay for us to say, I'm not quite sure what to do, but I can look and see if I can figure things out, or I'll look into, make some connections and get back to you. There is an organization through the state called Parents Reaching Out. And I'll often recommend parents look at this. There's a website online. This is where parents support. So a lot of times they've been through exactly what you're going through and they know the steps. So they want to kind of give back. And so they'll help parents to go through a similar problem. The other thing is that I've had my special need parents come into the office and work with special need children that have similar issues. Most common thing is G-tubes. So it's not uncommon for children that have some special needs to need G-tubes for feeding. And if it pops out, a lot of parents have to end up in the emergency room, and no one wants to go to the emergency room. And I just as soon not have my parents go to the emergency room. So I've had a mom that will meet them at my office and teach them how to change out the G-tube on their own. So that's really a big support, I think, more than you would realize, just because, you know, it empowers parents when they're able to do things. So the other thing that I try to encourage families is to keep perspective, looking at the successes we make, you know, on a day-to-day basis and focusing on those. Maybe life success would be a good way to look at it. And I really encourage them to take charge of things because I think they're their child's best advocate for sure. And then I really encourage them to just focus on living a healthy lifestyle, you know, enjoying that time with their child, finding ways to support themselves, finding, you know, respite. One of the things when I was on the autism board that we would do is we would support families that needed respite so that the parents could go away for the weekend and there would be someone that would come in and stay with their child. So I don't know if anyone had any questions. I saw a few things pop up, but I'm looking at my phone, so I couldn't read them as well. Let me see if they come up. Someone posted the MChat for me, which was great. And then the autism evaluations at UNM. So thank you for doing that. And then they posted about the 504 accommodations, IEPs. That's a whole big area that a lot of parents don't understand. But I think that's where some of the waivers will really help families, is understanding what options they have out there.
Dr. Williams, actually, my question around that specifically, you were rattling off a couple different diagnoses that qualified, and I wasn't sure where your definition was coming from because disability is defined differently in a couple different places and there are some other services. So I was wondering if you had specification on what that list is. Is that specifically for early intervention programs or?
You know what? That was from the American Disabilities Association. It was just like I was looking online for resources because there's so many things that can be considered a disability. So. All right. Does anyone else have any questions?
Hi, Dr. Williams.
Hi.
I have a question. So I'm a first-year resident, and it's not very clear to me, like if I haven't encountered a patient that I have to refer for an autism evaluation, but if I do, like how do we support parents if the waiting list is 1 year or half a year or so? Like, what should we be doing initially and during that waiting time?
So, that's a good, because one thing I always tell parents too is if we're going to get an evaluation, what are you hoping to get out of it? Because I definitely have that parents will say, oh, I think they might be on the spectrum. And they're kind of a quirky kid, especially as you get a little bit older. But I think, what's that benefit of getting a diagnosis? So if you have a young child, I always think about physical therapy, speech therapy. The child that you're talking about?
I'm sorry?
How old is the child you refer?
No, I have not encountered any child, but just in a specific, what should we do? Since like it's very stressful for a family to get one kind of suspicion of diagnosis, like what should we do in the meantime?
And are you in Las Cruces?
Yes, but I'm moving to Alamogordo next year, so.
Okay. So in Las Cruces, we also have an organization called The Play. I think a lot of children that kind of have autism type symptoms, I guess, also have sensory issues. And the Play Lab is really great for helping them to learn to self-regulate. As children get older, say they're in more of that high school age, there's actually a counselor, psychologist there that helps them with peer skills. So I really like the Play Lab. So you really can provide several things that often insurance is going to pay for until you get that diagnosis. And the diagnosis, for a lot of ages, the big thing I think about is the applied behavior analysis. Parents, if they had money, could probably get that without the diagnosis, because honestly, we would all benefit by applied behavioral analysis. I've just seen the training and stuff, and it's really great therapy. So, yeah.
Thank you very much.
Uh-huh.
Dr. Williams, I have a question. When you speak to families and you speak to them about a potential diagnosis, how do you approach the cultural aspect, where you might have some families that, in their culture, these developmental disabilities are a big taboo, kind of like, oh, my child doesn't have that. How do you approach that?
So I find, first of all, and I think it's because the change in our world, that I don't see that as much as I used to. And I used to see that. And what I've often done is talk about just my own personal experience of how having those therapists involved has been like a teacher to me. My first two kids were really late walkers. So I was involved with early intervention for them. And even as a pediatrician, I just felt like I grew so much because that physical therapist or speech therapist understood my child in a different way. My next child was really online with things, and I used a group called Parents as Teachers, and I just asked them if they could help me out. And so they came in, and I would say the same thing. So I usually tell that personal story about that. And then I asked them just to consider if they would just even meet with the person and evaluate and see what they think, and see if they might be just open to getting an evaluation.
Thank you.
Mm-hmm.
I definitely have another question, but I don't want to take up all the time. What are your recommendations about around like cultural considerations for applied behavioral analysis? What about if we were practicing in a place with scarcity? What do you think about like parent-mediated intervention or parent coaching as possible interventions that might be able to help if ABA isn't the option or isn't available?
I would think that could be really helpful. I find, especially if there's a parent that's been through a similar situation, they may have a really good perspective. So, yeah. And it's a good point about the cultural differences, because that's something I think we all as physicians have learned. All patients and families respond differently. And and we all have different backgrounds. We all come into this field with different experiences and backgrounds. And so being aware of that, I think, is really important. Any other things you guys can think of? I will say, just working with families with disabilities, I think, has been really rewarding. And it's challenging. I would say, in addition to just general pediatric support, there is a physical medicine and rehabilitation specialist in Albuquerque, and that's been really helpful. And then in Phoenix, there is a neuromuscular neurologist. So I have a patient with some concerns for like muscular dystrophy. That's kind of a whole new specialty that was not around when I was first training, but I think he has a really great understanding for some of those children that have weak muscles.
All right, so if we have no other questions, we will close it out for today. Dr. Williams, thank you very much for joining us today.
Thank you. Bye-bye.